My name is Brianna Gregory, pharmacist and physician liaison with Physicians Preference Pharmacy, if we have not already had the pleasure of meeting. And I'm so excited to talk to you today about one of our more recent compounds, although it's not really that new, compounded Amlexanox. So this, yet again, is something that I do take myself. So I'll be sharing with you some of the personal experiences that I've been having, and of course, what we've been seeing clinically in our patients, because that is first and foremost the reason that you are here. So we're going to go ahead and do that. I'm going to begin by sharing my screen and we're going to get rolling. So one of the reasons that it has prompted us to begin compounding Amlexanox is that over the past several decades, of course, we have been getting ourselves further and further entrenched in the spot of metabolic disease. It seems to be downward spiraling. And also over the past 4 or 5 years, what we've really been seeing is that complications of viral infections are really exacerbating where people are metabolically, if not actually highlighting why metabolic flexibility and being metabolically strong is so important in helping to prevent the development of chronic conditions, cancer, and making ourselves more immunodeficient. So I can't wait to talk to you about some of the approaches and uses for Amlexanox this evening. So if you do not yet prescribe with us, or maybe it's just good to have a recap about this sometimes, then I want to let you know who we are and what we believe at Physicians Preference Pharmacy. And because our goal is, as a compounding pharmacy, to collectively support your practice and essentially function as an extension. We really want your patients to feel like we're all on the same team here, and that's how we believe that it should be. So we are a compounding only pharmacy, non-sterile, so we don't do any injectables, IVs, and no ophthalmic preparations for the eye. We do specialize in bioidentical hormone replacement therapy, even though I don't actually focus a lot on that in my education and webinars. It really is a staple of what we were built on. But we focus a lot on peptide therapy, as well as immune-modulating compounds, which is something that we're going to be focusing on tonight with Amlexanox. So each of our preparations, regardless of what it is on our formulary, are always going to be free of any unnecessary dyes, binders, fillers, artificial sweeteners, lactose, parabens, basically that stuff that is just unnecessary to the function of the compound. Plus, we never want to have any hormone disruptors in there. Of course, we always want to provide your patients with the cleanest products possible. Dosage forms that we offer include oral capsules, which is what Amlexanox is compounded in, so we'll talk about that. Oral suspensions, sublinguals, which is what a lot of our peptide formulations are available in, and then topical and vaginal creams, as well as nasal sprays. And that goes for some of the peptides that we provide, some of our chelating agents, and things of that sort. We do ship to 49 states, so collectively we hold 49 licenses. We no longer ship to the state of Alabama, and all prescriptions must be written patient-specific, and patients are responsible financially for the purchase of their own prescriptions, so no billing the clinic. We believe that prescription drugs are commonly overprescribed in the Western medicine model. And so rather than addressing, just basically placing a Band-Aid on the issue, we want to take a root cause approach. And so that's what our focus is in partnering with you, is helping to really peel back the onion of what's going on with your patients and work together to be sure that we're optimizing their treatment regimen and their plan. And then lastly, we are accredited by the Pharmacy Compounding Accreditation Board, which is a voluntary accreditation. I think that this is actually really important for you to know as a physician, because you should, of course, have faith and confidence in the compounding pharmacy that you are prescribing to, really any pharmacy that you're prescribing to. So the fact that we take an elective accreditation and go through multiple different types of not just accreditation gates, I guess you can say, but also having routine inspections that supersede federal and state laws is really important, because each place where certain raw ingredients, whether that's active ingredients or inactive ingredients, are being sourced. And they have their due diligence to test that. But we also feel like we need to test those again and also test our compounding practices, which is why we test on site for verified weight testing. And then we send out multiple samples per week to a third-party laboratory to verify our processes and be sure that our potency is what it says on the outside of your patient's bottle. So we're going to talk about Amlexanox. So my question to you, as we reframe our mindset around what we're talking about tonight, is, do you have patients with chronic inflammatory conditions or autoimmune diseases, metabolic dysregulation, or what about other conditions who are treatment refractory? I think this treatment refractory space is becoming larger and larger and larger. And one of the areas I really like to focus on when I'm giving these presentations are products that have multiple applications, because our patients' regimens can get very expensive very quickly. So anytime that we can either slim that down or give them one compound that is going to function across their treatment plan widely, that's going to be very helpful for them. Also increase compliance because their treatment regimen will be more affordable as well. All right, so what is Amlexanox? Well, aside from being probably everyone's favorite compound to try and pronounce, Amlexanox has been around for a long time. Now, it's no longer commercially available. It used to be branded as something called Apthosol, and Apthosol was an oral paste that was originally used topically inside of the mouth to address aphthous ulcers. Now, it's still used widely in many places, such as Japan, for treatment of asthma, allergic rhinitis, and conjunctivitis. It also shares structural similarity to cromolyn, nasal crom, and gastrocrom. And this is because it functions as an antihistaminic mast cell stabilizer. A lot of those people that we're using Amlexanox in are those with mast cell activation syndrome who have histamine-related issues. And there's an undeniable overlap there, which is, again, why Amlexanox has such a broad application. So the structure of the molecule is important, especially when it comes to how Amlexanox functions in many ways like a steroid, but without the nasty side effects that we don't like. So really, it makes it a very novel anti-allergic and anti-inflammatory drug that, as studies come out and research emerges, we find have more and more applications. And this ranges from metabolic disease, mast cell stabilization, immunomodulation, and correction of gene expression. So we're really getting to the root cause of what's happening here and helping to tame down the body's overreaction or inappropriate reaction to its environment. So who should be taking Amlexanox? A lot of times I'll get questions from you guys about, I have patient with XYZ, and here's what I'm thinking I should do. Am I on track here? And generally you are. And a lot of times I think something that we haven't thought about implementing yet is the Amlexanox. So a lot of times I will come back and say, well, have you thought about Amlexanox? Because rather than prescribing 2 or 3 different things to this patient, you might be able to get away with one. So those with chronic inflammatory conditions, autoimmune conditions, mast cell activation syndrome, which is MCAS, metabolic dysregulation, this is a big one here. Chronic and, again, treatment refractory skin conditions such as eczema and psoriasis, we see improvement in with Amlexanox. Those who have a desire to lose weight, we'll get into a little bit of the common pathophysiology behind a lot of weight gain for people. And then also think about conditions that are related to T helper cell dysfunction, because those patients are very likely to be very good candidates for Amlexanox. Okay, so I have a few slides here about Amlexanox and immune balance or imbalance. So again, Amlexanox acts on T helper cells, balancing Th1 and Th2, so T helper 1 and 2 cells, while reducing Th17 overactivity. And these slides aren't necessarily meant to be fully legible for you. The point I'm trying to illustrate here is we're always trying to bring the body back into balance. So when we have symptoms of Th1 dominance, we get side effects or symptoms such as delayed food sensitivity, fatigue after meals, low T3 syndrome, also thinness, and that's due to low appetite, Th2 dominance, Th2 higher than Th1. We start getting IgE skin allergies, postnasal drip, a lot of the the mucus, the throat clearing, those mast cell activation type syndromes, symptoms associated with the syndrome, eczema, GERD, histamine intolerance. So this Th2 dominance is a place where I focus often with our patients, and I try to with our providers too, because we're seeing a lot of it across the board. Another good illustration here is that when we have dysregulation of any type of T helper cells, or T regulator cells, then we're going to have imbalance here. So we have more autoimmunity when we've got imbalance of Th17, also some relation to cancer there. Th2 kind of functions as the overprotector, definitely has a strong link to inflammation, particularly in what we call the open cavities. So the vagina, the lungs, the sinuses, the bladder, the gut. It has a close interplay with mold and candida as well, and then inflammation in the brain. Also Th1, that kind of comes up as our fighter for cancer, and also when we're talking about bacterial and viral infections. So we want to be sure that all these guys are in balance and being set up for success with what their intended roles are. And we are seeing a lot of patients come to see us that have major dysregulation, which is where Amlexanox comes in handy. Now, I took this slide from a webinar that I listened to many, many months ago. It was hosted actually by Pure Encapsulations, which I have no affiliation with Pure Encapsulations or anything like that, but I did think it was a good slide. So I added it here because, of course, we got a lot of patients with dysbiosis, and there is an immunological cascade that comes from that. So whether or not we're talking about gut dysbiosis or we're just talking about imbalance in the body, what I thought was interesting here is that when we're looking at T cell dominance or too much of it, again, those mast cells and the histamine is being affected. It has an effect then on Th1 cells. We put ourselves at increased risk for infection. Then we start getting into this spiral of there was a traumatic injury, traumatic event, viral bacterial infection, ate a bad meal, made the person sick, divorce, miscarriage, like these types of things that are really impactful on the body and in someone's life that can trigger them, that then puts their body at a new state or kind of raises their baseline. And this is when their mast cells in particular, which are white blood cells, immune cells that live virtually in every place of the body, specifically in the central nervous system, start to overreact because now we are in an amplified state of fight or flight, essentially. And so we have to try and unwind the damage that has been done. But I see a lot of patients who get this GI epithelial inflammation, systemic inflammation, brain inflammation, and then they're just spiraling downward. So I think of Amlexanox in many cases as a maintenance medication for those that are probably pretty bad off. And for other patients, it may be almost more of a rescue medication. So I'll try to explain that a little bit better of what I mean. But the other thing about this is you don't have to use Amlexanox necessarily every single day, multiple times a day to get an effect, which is a beautiful thing. So one of our focuses here is metabolic dysfunction. We have a big problem with this. There's a study here that it was written in 2017 talking about inhibition of the IKK epsilon and the tank binding kinase 1, improving glucose control in certain patients with type 2 diabetes. So inhibition of those, improving glucose control in those with type 2 diabetes. So this particular article right here is the second of two, really. There was an initial study that was done that was an open label study. Really, the purpose of that is just to ensure safety around the use of Amlexanox. And then later on, there was a follow-up study for proof of concept dosing in that second study up to 50 milligrams 3 times a day. We'll get into dosing in a little bit, but 50 milligrams 3 times a day for the purposes of this study. And the goal was to see if the inhibition in these areas of the cells was important in correcting or improving metabolic dysfunction. Now, you may be hearing some buzz around Amlexanox for weight loss, and here's why. It's inflammatory driven weight gain that Amlexanox is helpful with. Now, is that the reason for all weight gain? Probably not. Is it the reason for a lot of weight gain? Maybe. But the way that it works is that we know that there's an inflammatory link between obesity and type 2 diabetes. It seems kind of obvious. But initially, when we're looking at these inflammatory kinases that we're talking about inhibiting in this study, they're elevated in obesity. So when we inhibit them, we see reduction in weight, improvement in insulin resistance, and then also improvement in the profile of fatty liver and reduction in inflammation. So this was a double-blind, placebo-controlled study of 42 obese patients with type 2 diabetes and non-alcoholic fatty liver disease. And I know you guys are seeing more non-alcoholic fatty liver disease in your practice. We sure are. Also, we see a significant reduction in hemoglobin A1C. So same article. I do like this little table or schematic over here because it allows you to give your patients a bit of a timeline for expectation, especially if they're using it for something like weight loss or even just improvement of metabolic markers, hemoglobin A1C, we're looking at insulin, all of that good stuff. How are they going to know when to be able to see results? And how are you going to know if you need to increase the dose or prolong the duration of therapy? So we also see that obesity produces chronic low-grade inflammation in the liver and in the fat. And these are two reasons why we know Amlexanox is helping there. I'm telling you it can because it gets good concentration there and helps to decrease inflammation in those particular cells. So when we get a local secretion of cytokines and chemokines, that attenuates an insulin reaction. So this table is in specific to this actual study. And again, the doses were higher than what I typically recommend, but I still think that the expectation of what people should intend to see after 2 to 4 weeks, 3 months, 4 months is still going to be pretty much on track. So after a couple of weeks, increased serum IL-6 levels. After about 3 months, better insulin sensitivity, thermogenic gene expression in fat, and then at 16 weeks, insulin sensitivity returns to baseline. So I'll tell you about some success stories with this too. And this particular study just went 16 weeks because that was the parameter that they had set. This is not a hard cutoff for dosing Amlexanox for just 16 weeks though, just to make that clear. So we also see, same study, anti-diabetic effects of the IKK epsilon and tank binding kinase 1 with Amlexanox helping to inhibit those. So again, this can kind of translate, even though the initial studies were in mice, this one was in humans, that we see that there's that translation to the insulin response. And again, a significant effect on hemoglobin A1C. So just note here that studies have demonstrated that the downregulation of the immune system and the attenuation of TBK1 and IKK epsilon signaling are helpful in inflammatory conditions such as MCAS, cancer, and obesity. So obviously inflammation is a staple for all things that we're looking at, but we may not always think of that as an important component for weight loss. Toxicity is going to be a big part of people packing on weight too, which probably is driving a lot of inflammation. So it's important to address that as well. After just 12 weeks of treatment, hemoglobin A1C was reduced in 4 of the 6 patients. Measurable reduction in fasting blood glucose, insulin resistance was improved, decreased hepatic glucose production, and improvement in all measures of insulin sensitivity. So here I've broken down some benefits and uses based on the mechanisms of action of Amlexanox. So it has quite a few mechanisms of action. As a pharmacist, that's always what I'm going to be most interested in because it tells me about the wide array of applications on how a drug works. So it does work as a mast cell stabilizer. I put this at the top because it's probably the #1 reason why we use it. So it reduces the release of histamine and leukotriene mediators in the mast cells, neutrophils, and monocytes. So mast cells are very intimate, they're very interactive. with their environment. They've got, they are not interact with basically 300 or more different things. They got a lot of receptors going on the surface of it. They're very interactive with hormones. They release a lot of histamine. They released a lot of granules that come from that mast cell when it interacts with something else. So we want to be sure that we are stabilizing that. And again, when you've got these patients that are in a downward spiral because they've had the trauma, the inflammation, the food sensitivities, the dermatological issues, the dental issues. I mean, there's really nothing that they're not experiencing. We have to stop the bleeding, so to speak. And I've seen Amlexanox do that over and over again. So it's not the end all be all. It doesn't fix everything, but it allows them to stabilize to the point where then they can start healing. Very complex. So in cancer, one of the reasons Amlexanox is helpful there is because it inhibits Th17 cells, but not Th1 cells. Again, it's bringing Th1 and Th2 into balance. Good in longevity and inflammation. It promotes cellular autophagy via the mTOR pathway and induces apoptosis. So we want to keep the good guys alive and kill off the bad guys. It's an immunomodulator by modulating macrophages, balancing again Th1 and Th2, and regulating T cell function, and for neurodegeneration. So it decreases inflammation and oxidative stress and erectile dysfunction, promotes maintenance of an erection due to PDE5 inhibition, like some of those drugs are already working that you're already familiar with, and also as an anti-fibrotic. So we're seeing it more and more being used in non-alcoholic fatty liver disease, and it binds to fibroblast-like growth factor. It's useful in atherosclerosis because that's a type of fibrosis, liver cirrhosis, and also in fibrotic tissues and other related diseases. What about metabolic disease, obesity, and diabetes? So I've talked about the connection to inflammation, but I actually just kind of want to read this one through, although you can refer back to it yourself, because we want to be sure we're using it correctly and dosing it high enough. So Amlexanox stimulates lipolysis via AMPK, reduces insulin resistance, stimulates the mitochondria, lowers cholesterol. A lot of that has to do with its action in the liver. If obesity is caused by Th17-driven inflammation, this is really important. Visceral fat tissue may become resistant to lipolysis. That leads to obesity, insulin resistance, and metabolic syndrome. So Amlexanox helps to lower that T17 inflammation, sensitizing the fat cells to lipolysis and leading to fatty acid oxidation and reduction in fat volume. It's pretty awesome. Also, vasodilation can help to reduce blood pressure, improve circulation. We talked about non-alcoholic fatty liver disease and then psoriasis. So in a lot of our treatment refractory patients with psoriasis, because of the anti-inflammatory effect, but also because of the balancing of Th1 and Th2, where we get a lot of these dermatological issues being amplified by bringing those T helper cells into balance. This is why we're getting good resolution with Amlexanox there. Now, we do have some pretty compelling information published about the correction of gene expression in cystic fibrosis. So this is something to look into more. It's specifically because the nonsense gene mutation, which leads to that misfunctioning chloride channel that's present, can actually be corrected. This is very interesting stuff. Asthma, allergies, and bronchodilation. So we have some great success stories here with people using it for respiratory rescue, being able to come off of their inhalers by introducing Amlexanox instead. And that's because it inhibits phosphodiesterase and CAMP, so it helps to lead to that bronchodilation and reduction of inflammation in the lung tissues. It also decreases the allergic responses by inhibiting histamine released from the mast cells. We do get a lot of respiratory issues in mast cell activation syndrome. Also in long haul, there's a very close overlap there with mast cell activation, but it helps specifically to reduce brain fog, improve oxygen delivery to the lungs, which we talked about, reducing that histamine release, and then also inhibiting the IgE-mediated degranulation of mast cells. So I want to provide you here with a couple of clinical pearls. I, with his permission, put a quote in here, and Dr. Salibi is a friend and colleague that we have partnered up to learn together and write together about Amlexanox. And I learned so much whenever I talked to him. And he actually was the physician that initially came to us and said, hey, can you guys make Amlexanox? I said, what the heck is Amlexanox? So dug into it a lot. And I'm so glad that we brought this on many, many months ago, if not almost a year ago now, to help so many people. But when I initially asked him, what's your take on why you use it as a prescriber? He says he uses it for issues with histamine and inflammation, which we've talked pretty much extensively about. Also, multiple systemic infectious disease syndrome, chronic inflammatory response syndrome, chronic Lyme. He sees a lot of Lyme, back injury as well. So these people that present with the need for H1 and H2 blockers, or even are taking high dose steroids and have trouble tapering off, Amlexanox is a good way to interject and help these patients. So he's talking here about ulcerative colitis or Crohn's. So he's able to successfully get patients off of H1 and H2 blockers, and more importantly, high dose prednisone. So generally starting patients out at 40 milligrams daily, and then if they can tolerate it, moving up to twice daily or 3 times daily when indicated for more resistant cases. So I personally take 40 milligrams, which is our most common dose prescribed, 3 times daily. I live in Houston, Texas. It is some wild weather down here, and there's a lot of things that circulate off the coast, and we've got a lot of pollen, and there's just a weird mix of stuff. So where someone is geographically is probably going to dictate how much liberty you need to give them when they dose Amlexanox. Amlexanox is really safe. The only side effect that I've ever heard anyone explain is nausea. And when I take it, I would say that I explain that as mild queasiness. And most people just get a little bit queasy, and that's resolved by taking Amlexanox with a meal. But most importantly, it can be taken with a light snack. You probably have some of these patients that might be good candidates for Amlexanox also intentionally fasting using time-restricted eating programs, which is something I do as well. So just having a little bit of half and half, or cream in the coffee in the morning, or grass-fed cream, something like that, at least for me, is enough to coat the stomach, and I have zero problems. But point being is that sometimes of the year, I just need 1 capsule. Right now, I'm relying on 3 capsules, and that's 1 capsule 3 times a day. It should be spread out to give your patient full coverage. Now, I do really want to point out that for probably 90–95% of patients, 40 milligrams, 1 or more times per day is going to be your sweet spot. Something to keep in mind here is that your patients are going to pay based on the number of capsules that they purchase. So unless you have a super, super, super duper sensitive patient, meaning I probably have 1, maybe 2 patients on this 10 milligram dose, it's not really cost effective to prescribe a 10 milligram with the intention of them slowly working up. I don't think you need to be that cautious. I don't think it's necessary. And in most cases, it's going to be subtherapeutic. So only unless someone is extremely sensitive would you want to start this low. And just to be clear, 10, 20, and 40 milligrams are immediate release. 60 milligrams is a sustained release. It was kind of funny when I initially sent out my prescriber communication on Amlexanox several months ago. I also attached a webinar that I thought was fantastic. It really dove into the pathophysiology behind a lot of the things we use Amlexanox for, and also the chemical structure of Amlexanox and the pharmacology. And so, of course, I thought that that was just great. One of the things that they mentioned in there is they were working with a pharmacist that had developed a 60 milligram slow release. And so as a result of me sending that out, I had a prescriber come back to me and say, well, you sent this out, you need to start making this. So we make it. Do I think it's the best formulation? No. The reason we do it, and the reason that other pharmacists started that idea, is to increase compliance. So if your patient needed, let's say, 40 milligrams 3 times a day, you could then get away with 60 milligrams twice a day, cut out one of those doses and give them the sustained release formulation. So that truthfully is the only reason it exists on our formulary. I have very few people on it, but it's an option if you think it's going to best fit your patient. All right, so let's talk about some clinical success. So some prescriber feedback. So what's going to resonate with you clinically? Well, I've had a prescriber tell me that with food allergies, he primarily sees patients with food allergies and autoimmune conditions. So his patients are reporting reduced food sensitivity and reactions and reduced inflammation once taking Amlexanox. Also, another prescriber, patient with type 1 diabetes. So I have a type 1 diabetes patient who has been on insulin for decades. With the addition of Amlexanox 40 milligrams daily, so that's just once daily, plus sirolimus, which is rapamycin, 5 milligrams once weekly. They brought her hemoglobin A1C and blood sugar into range. She says she feels great, lost weight, and she's no longer dependent on her insulin. I think that is so cool. I love hearing that. Also, long COVID. So in practices that treat a lot of long COVID, very successful in these patients, primarily to help with, again, the brain fog. And the reason why that persistent brain fog is there because of the excessive mast cell overactivation. Again, the mast cells are largely present in the central nervous system, in the brain. And so when we can calm them, then these patients basically aren't having that inflamed brain. Their brain is literally swelling. It affects the blood-brain barrier. And then we start getting exchange into the brain of things that we don't want. So a lot of this, again, is inflammatory related. And then what about patients? So patients saying, my bronchospasms have improved greatly starting week 1, and I no longer am using my inhaler. That specifically was a rescue inhaler. One of my severe MCAS patients had written to me, I added on Amlexanox 40 milligrams, again, just once a day with good results. The first 2 days, I was still having to use my inhaler as well as my nebulizer. And the third day, I was only using my inhaler. So I love to see this reduction of polypharmacy, and actually have an article in peer review right now on Amlexanox. So some case study write-ups that I'm co-publishing with a colleague. And I spoke about this patient's case study in there because it was so remarkable to me. She started out when she first came to me with 81 different supplements and medications on her list. So classic case of polypharmacy. And we brought her down after being on Amlexanox just a couple months to, I think it was either 14 or 18 different medications and supplements combined. So praise God that this is an option. This is a classic case of polypharmacy, which is really important for me as a pharmacist to reduce that. So here are some resources for you to read further or share with your patients. So each quarter, I do publish a newsletter that gets posted on our website. So please do use the website as a resource. We've got our drug catalog on there, as well as these newsletters. I intentionally write the provider version and have the patient version published at the same time, so you guys can be having this open conversation with your patients about the same information. It's being presented in the same format. Also, you can print these up and put them in your office if you want. I have a lot of clinics that do that for some of these repurposed medications that patients haven't heard about. They want a little bit of reading material before they decide to get that prescription filled. So you're more than welcome to do that as well. So I want to thank you so much for your time and attention. If you would like to prescribe Amlexanox for your patients, you'll have access to the RX order form to be able to do that. You can fax or e-scribe to us. You can call us, of course, and call those prescriptions in verbally. And you can always visit our website at physicianspreferencerx.com. Here's my information and my email, which you should have because you received the invitation to this webinar. And then I probably don't say it enough, but as a prescriber, you get a 20% concession on your prescription orders. So please be sure to take advantage of that. If you're like me and you like to try things before you prescribe to your patients, if appropriate, try the Amlexanox. And if you feel like you kind of fit into this treatment refractory bucket or some of these inflammatory issues that's happening, I encourage you to do that so that you can speak to your patients in a way that is coming from an area of experience. So I'm going to stop sharing now and see if we have any questions. You certainly can drop your questions in the chat if you'd like to. I do want to also talk about the pricing as well of Amlexanox. So if a patient is going to take just one a day, then they're looking at, for 30 capsules, $59. If they're going up to 90, they're going to take, it's going to be 129. So 59, 89, and $129. That's for 30, 60, 90 capsules, just so that you can give your patients kind of a ballpark of what to expect with this. But again, think treatment refractory, think the patients that have expensive regimens already and that you would like to help limit that for them and bring that medication list down. So again, if you have any questions, you can drop in the chat now. Otherwise, you can always email me. And, I always want to make myself available to you if you have specific questions about particular patients that you think may be a good candidate for Amlexanox. Think mast cell, think long COVID, think treatment refractory, think skin issues, anything that is a result of Th1 and Th2 imbalance, autoimmunity. These people are going to be really good candidates for Amlexanox. So, all right, guys. Well, if we don't have any questions, I'm going to let you go and enjoy the rest of your day. But if anything comes up, please do feel free to shoot me a note. And it was a privilege to speak to you about one of my favorite compounds today. And we will catch you next time. Take care.